Good morning, everyone. Thank you for joining us. This is Sarah Diaz from the California WIC Association. I'm here with Karen Farley, and we're just here to facilitate the technical end of things and support you in learning some more about different technological innovations that can be used in the WIC community, because we know that's a really important topic for everybody. I'm going to go ahead and unmute everybody if I can, and so that you can ask questions as we go along. But if you're in a loud environment, please go ahead and mute yourself so that's not disruptive. And I'm also going to be recording this webinar so that if you miss part of it, or if you have a staff member who would have liked to be in on it, they can go ahead and listen later. And with that, I'm going to go ahead and turn it over to Lindsay from Pacify and get started.
Okay, hear me now?
Yeah.
Okay, great. Karen, did you want to give a little introduction?
Yes, just basically, as Sarah said, you know, our role as CWA is to support the local agencies in engaging families, and so we're all looking at different opportunities to do that in various ways and points on the experience using WIC services and benefits. So today we wanted to share with you, and some of you might be familiar with this opportunity, this app, to see what Nevada has been doing using the Pacify smartphone app, and hear from
Somebody's environment is a little loud. Oh, that's Felicia's.
Hear from Lindsay Dermott-Gray, who's the Nevada State WIC Breastfeeding Coordinator, and Lindsay Stokes from the Pacify company about the app, and then we'll talk about potential opportunities here in California. But we just really wanted to share this with you as an exposure to this type of technology that's gaining some ground, not only in WIC, but in nutrition and healthcare.
Okay, great. So good morning, everybody. My name is Lindsay Dermott-Gray. As Karen and Sarah said, I'm the statewide breastfeeding coordinator for the Nevada WIC program. I am going to be talking about the Nevada WIC program's partnership with Pacify that we have for a little over a year now.
We missed the last part of your explanation. There's a lot of background noise.
Karen's explanation?
How long have you been doing this?
For a little over a year now. So Nevada WIC is very fortunate to be among the first WIC programs nationally to partner with Pacify. Pacify has been a huge asset in linking our WIC moms, especially those in rural areas, with professional lactation services. Today I'm going to give an overview of Pacify services and discuss how this smartphone app has fit into our WIC program. Laura Stokes from Pacify is sitting in on this webinar as well, so if you have any Pacify related questions that I'm unable to answer, hopefully she can assist us. So Pacify is an app that anyone with a smartphone can. Am I unmuted again?
Go ahead.
Okay. So you can download it, or you can even purchase a subscription to it as a gift for a pregnant friend. Once the app is downloaded, you have the ability to connect to either a nurse, a pediatric nutritionist, or a lactation consultant 24 hours a day, 7 days a week in both English and Spanish. So the two images that you see here on your screen, the image on the left depicts the home screen of the app, and the image on the right is an example of what a video call with an Ibclc or RD would look like. So this is Nevada. So as you can see on the graph below, we have the lowest number of IBCLCs per live birth of any Western state. With the exception of Reno and Las Vegas, the vast majority of our state is made up of rural and frontier towns. In many of these rural areas, the nearest peer counselor or IBCLC is 100 miles away or more. The purple color of the map reflects rural counties where Nevada has WIC clinics. As part of the WIC model, each WIC clinic staff is required by policy to receive a 35-hour breastfeeding training every 5 years, but peer or professional lactation support exceeding that scope is absent. So in each of these 14 rural counties, we have one clinic, and in each of those 14 rural clinics, we introduced the Pacify app to offer that historically absent layer of support. So that's where Reno is there at the top and Vegas at the bottom. And at 14 clinics across our state, we have implemented the Pacify program. So our goals for introducing the Pacify app are listed here. So of course, we wanted to increase initiation, duration, and exclusivity of breastfeeding among our WIC moms. We wanted to increase healthy eating habits and nutrition awareness. And we wanted to increase retention of children and engagement with other WIC services. So here on the right of the screen is our breastfeeding rates. You can see we're pretty on par with the average rates across the U.S. So how did Nevada WIC start the process of offering Pacify in our rural WIC clinics? In late 2015, we applied for operational adjustment funds and were notified of our award in March of 2016. Almost immediately, the DC-based Pacify team was on a plane to Nevada to conduct introductory trainings at several of the WIC clinics who would be partnering with this program. Those that they could not personally visit received online trainings from the Pacify team. The trainings consisted of helping our WIC staff introduce the Pacify app to our WIC moms, ideally moms in their late prenatal period who could get comfortable with the idea of the app and have it geared up to go as soon as their first breastfeeding question or concern presented itself. The Pacify team taught our WIC staff how to show moms how to download the app and conduct a test call so that the moms could see firsthand right then and there in the clinic how easy it is to use and how helpful the app could be. In addition to individual level access on moms' personal smartphones, 2 of our WIC clinics in larger rural areas had smart tablets installed in their clinics that were linked to Pacify professional support. This setup was almost like having a full-time bilingual IBCLC or RD employed there at the clinic. It had the added benefit of having a WIC support person present to speak to historical weights and measurements and just generally provide assistance to the mother during the call. So during our OA period, the period that we had access to the OA funds, Pacify provided us with weekly reports with the following encrypted information. So they would send us reports with the mom's name, the date and time of her call, the reason she called, the care plan that was determined by the professional who she spoke with, whether or not the Pacify IBCLC determined a need for follow-up that would then be conducted by the IBCLC from Pacify, and the participant's rating of the encounter and qualitative feedback. WIC clinic staff could then circle back with mom, closing the care loop. So WIC staff were informed within a week's time whether or not a mom of their clinic was contacting the Pacify app and would be able to reach out to them to see if there was any added support that they could offer, if their needs were met and they were on a good breastfeeding trajectory. So this was some of our WIC participant feedback from our state. As I mentioned, each mom who calls the Pacify app, they're able to both rate it on a star system and give qualitative feedback. So this is just a few of the qualitative responses that we got. Somebody from Elko said, I liked her, she was really nice and said a lot of stuff that will help me in the end. Somebody from Carson City said, very nice and helpful and patient. I'm so thankful for her teaching me how to use the nipple shield to get my baby to start latching. And somebody from Pahrump said she was very helpful and I really liked the advice she gave me. This is some feedback from one of our WIC agency directors. This was the director of the largest clinic that also had the smart tablet installed in their clinic. And Judy says, we have had a huge success with enrolling moms and dads in the program, and they absolutely love the opportunity to connect 24/7 with experts. We live in an extremely geographically isolated area with few healthcare professionals, and the app has been such a great asset to families, especially those with low incomes who have limited access to healthcare. I can't say enough about how important this service has been to our clients. These are the numbers that were pulled at the end of the OA period. So in total, over the course of about a year, actually these numbers were pulled after the end of the OA period. So these numbers were as of last month. So in our very sort of confined, small, rural population, we had a total of nearly 600 moms enroll. Of those 600 moms who enrolled, there were 625 clinical consultations, which just shows you that moms who use the app often will call back again. The average star rating was 4.5 out of 5. The average call length was 7 minutes. The average age of the caller was 27 years old. The column on the right shows what were the most frequent issues called about. That data is not Nevada-specific data, but based on Pacify's full patient load, so across all of the U.S. So these were the assets and concerns that we took away from our experience with Pacify. So in Nevada, unfortunately, we have no Spanish-speaking IBCLCs at current, so it was a major asset to us to have access to Spanish language IBCLCs so that we weren't having to pull in other staff or use a language line. The 24/7 availability, that's a huge asset for moms with transportation or childcare concerns and those common middle-of-the-night concerns that breastfeeding moms often have. And of course, the majority, I would think of, our WIC families have transportation and childcare concerns. And that common middle-of-the-night concerns was reflected by the fact that 1/3 of the calls made were made outside of clinic hours. So it was great to have somebody available to them in real time to offer support. The other great thing about that Pacify program is that the Pacify staff often refer back to the WIC clinic, which strengthens the relationship between the Pacify and their clinic, but between the participant and their clinic. The concerns that we experienced is that we were concerned initially that this may result in a decrease of access to our contract IBCLCs. This concern was specifically as it pertains to expansion into our urban areas that have contract IBCLCs that WIC is funding. We were concerned that if moms had the opportunity to use a smartphone app, they would use that instead of seeing one of our IBCLCs in person. And we found that that concern was not actualized. So we were initially worried about that, but that isn't something that has come to fruition or caused a result in the decrease in the number of in-person IBCLC referrals. Another concern that we had was whether or not the low-income population that we serve would have access to smartphone technology. The Pacify has actually pulled data that shows that the vast majority, upwards of 90% of our moms will have access to smartphone technology. So that was not, that fear was not realized either. And the third concern is that for us, and I think for other states as well, FNS has required the discontinuation of the RD functionality and the RN functionality for WIC. So we are able to continue using the Pacify app, but we are only able to continue using it for the IBCLC functionality exclusively. A couple of our lessons learned from implementing this program, the WIC visit model made reaching moms at optimal Pacify enrollment time challenging. As I mentioned, we had selected a late prenatal period as being the optimal time for moms to be made aware of the Pacify app and maybe make a test call so that once the baby's here and an issue arises, they're comfortable with the thought of using the app. But of course, the period of time within which we had access to the OA funds was only about 6 months. So you're not seeing all of the moms who are on your participant caseload during that time. So what we did was we pulled a report of all the moms who would qualify for that this app would be in great timing for them to learn about, get comfortable using. So we had the WIC clinic staff, when they would have participant no-shows or other downtime, that they could spend that time reaching out to these moms and offering, letting them know about the smartphone app and offering a training and having them come in if they wanted to, so that they could download the app to their smartphone. We also found that some WIC clinic staff were pretty nervous about the new technology and using it themselves and offering the technology to their participants. But this concern was largely eventually alleviated by training and support from both the state office and the Pacify team. The Pacify team was very responsive to any questions or concerns that our WIC staff had around the clock, and so they offered a lot of opportunities to do both in-person and virtual and on the phone and over email support to help the WIC staff become more comfortable with the thought of using this technology themselves and showing our WIC moms how to use the app as well. So these are our next steps. Fortunately, we were just notified that we received the notice of award again for 2017 to support our continued partnership with Pacify. So we were awarded OA funds last year, and we reapplied this year with the goal of expansion, as I mentioned, into our urban centers. And we were just notified last week that we were awarded those funds. So we're really, really happy to continue our partnership with Pacify. In addition to expanding to our urban clinics, we are going to roll out these push notifications. So moms who download the smartphone app to their phone will have the added benefit of these tailored push notifications that we will develop in partnership with Pacify. DC is spending a good amount of time and care and concern crafting push notifications specific for their moms as well. The value of push notifications, of course, is increased education and communication. So you can set reminders and updates at key moments during the peri and postnatal periods, and also increased utilization. So reminding participants about access to support yields more engagement with WIC services.
Lindsay, if I could, we have a question.
Oh, sure.
I had ended up muting everybody because the background noise was just too much, but Arena from Trinity was asking, what was the justification for FNS not allowing RD-DN use?
Yes, so for the RN use functionality, they felt that that is outside of the scope of the WIC services. So that was why they chose to disallow us to continue the option of that service. We are hoping that we might be able to, through conversations and discussions with the decision makers, explain that it would be sort of maybe considered a referral program. So as WIC is a hub of community referrals, this could be viewed as a community referral. That remains to be seen. This is sort of a slowly unfolding process. As a lot of decisions with with this program and funding can be. So that was the issue with the RN functionality. The RD functionality they identified as being duplicative. as a lot of WIC clinics already have RDs in them. However, the rural clinics that we're serving, and I imagine a lot of the clinics in California that may be rural as well, don't have RDs staffed there, so it is not, in fact, duplicative in a lot of the clinics across our state. So again, we're going to probably, at the end of this cycle, go back to the drawing board with them and have some more conversations and see if we can have them revisit those decisions. But as for now, we're moving forward with just the Ibclc component.
And she had also made a comment about, I can see this being helpful for very small communities also due to the professionals not living in their communities, which would make some moms feel more confident about confidentiality, which is a good point, I think.
Right, yeah, absolutely. Were there any other questions?
If there's more questions, please either type them into the question box or go ahead and raise, you can click the little hand icon to raise your hand so that I can selectively unmute you so that we just don't have all the noise.
So I'm going to go ahead and turn the presentation over to Karen Farley, who's going to talk specifically about opportunities for the California WIC program.
Hi everyone, we're glad you got on the webinar and we hope you're learning a lot. So we're just offering this, as I said in the beginning, as one way that CWA can support the local agencies to learn about opportunities that are out there, and client-facing technology seems to be something we really need to beef up in WIC. And every state doesn't have the same situation. I'm sure you saw things that were, heard things that were similar from what Lindsay's saying and things that are different for California. But we have, we want to put some time into exploring this with you. So working with the Pacify staff, Laura's on the line and she can answer questions later. But we are going to explore some funding that is through nonprofit associations here in California to see if we can pilot some models for use here in California. So that's why Laura was at our conference and trying to share information about Pacify and find who might be interested in learning more and why we're offering this webinar. So based on this effort to this point, we're going to now go out and apply for some grants. They probably won't be very big, and we not sure what we're going to get, but we think we have a good case to make for adapting and testing client-facing technology for local agencies here in California. We've let the state WIC staff know that we're exploring this, and actually they're invited to be on here. I think some of the folks are. I haven't looked at the whole attendee list here. And then we'll move forward. And I just wanted to mention that working with Pacify, Delta Healthcare has actually applied for Office of Minority Health grant. They haven't heard how that is, but they've gone out in that effort on their own. And Delta Healthcare is in a community health center, so that's a little different setup. I can't remember. Laura can clarify if they're doing that through their health center or through WIC, but the WIC program is involved with that. So I'm going to stop here, and if you have more questions for Laura or Lindsay, please ask away.
So again, if you have questions, there's a little hand icon to raise your hand, or you can type it into the question box. There's a question. Melanie Silverman asked, is there a time limit on the time a mom can spend on the call?
No, there's no time limit whatsoever, and they're able to call as many times as they want throughout the day and night, as long as they have access to the service, which is actually, I believe, a year. Laura, if you want to speak to that. more specifically, but yeah, there's definitely no time limit that a mom is able to have a consult with a Pacify professional.
Yes, thank you for that question. And this is Laura Stokes from the Pacify. I just wanted to thank Karen Farley and the California WIC Association for organizing this and for creating a space for us to talk with all of you. And I also wanted to thank Lindsay and Nevada WIC for being such a great partner for us over the past year. Yeah, so that's correct. The subscriptions to Pacify end up being very similar to memberships to other services, where the access is completely unlimited. And so the number of times that you can call and the length of time that you spend on each call ends up being completely unlimited. So that's a great question. Thank you.
And then we have, can the speakers address costs for services, and how does that work?
That's a great question. Go ahead.
No, thank you, Laura. I was going to hand it over to you.
Thank you. So this has evolved a bit over the past few years that we've worked with WIC. So originally we thought it would be easiest for the state agencies and the local agencies to be able to purchase individual licenses to the technology, which are essentially individual memberships. So they would buy 1,000 memberships to be able to give out to their participants. And the cost per membership is discounted because they're buying them in bulk. We're now, because of the unpredictability around participation, we're now moving to an unlimited statewide license or agency-wide license model, where instead of buying a certain number of memberships, the agency can buy an unlimited license to cover their entire population. And that way you don't have to track enrollment or worry about sort of having too few or too many licenses each year. And so that has streamlined the sort of process. And then to answer the question about cost specifically, it ranges based on the participation numbers in the area that we're serving. So obviously California is a huge state, so and Nevada's population is a little bit more spread out, is a little bit more concentrated than California. So that was a little bit simpler than I imagined the pricing would be for California. But what we normally do for a pilot is to try and back into a budget where we can say, working with Karen and the California WIC Association, we'll say, we were able to get funding at this amount. How many moms can we serve with that amount? And then we'll size the pilot based on that. Does that make sense?
She is muted, but I'm not seeing any other questions yet. Does anyone else have any other questions? Oh, she's asking, is there a dollar amount?
Sure, yeah, so we can give a range. So we launched a program that was statewide in Mississippi last year that served about 2,000 breastfeeding moms, and it was about $200,000. And I believe the statewide program in Nevada is between $250 and $300. Is that correct, Lindsay?
Yes. Yeah. So the expansion into both urban and rural clinics, and then the push notifications and the marketing materials, yes, between about $250,000 to $300,000.
So what we did in Mississippi, the regional FNS office was wondering what the cost comparison was to hire full-time IBCLCs or part-time IBCLCs to cover the state, and I believe the cost was about a third of the the in-person support, which they weren't able to provide because they don't have IBCLCs or RDs living in those areas, in the remote parts of the state.
I went ahead and unmuted you, Mary. If you wanna, you can ask your question. Or maybe she doesn't have sound. I'd like to hear what the improvements in breastfeeding rates were in Nevada as a result of adopting this model.
Yes, I would too. So we have kind of a dinosaur data collection system here, which we are currently in the process of relieving ourselves of. We have been working on acquiring a new management information system for about the last year. So we've been piloting and testing this new management information system. So the data is it's not something that we're able to access at this point, but we will be starting for this particular OA period, we will be able to track more effectively and accurately changes in breastfeeding rates over this particular grant cycle.
This is Laura. I do have Mississippi WIC had a similar program to Nevada last year. Theirs was statewide right off the bat, and they saw improvements in their breastfeeding rates both at breastfeeding at 3 and 6 months, as well as exclusivity at 3 and 6 months. So their breastfeeding figures are very low, so don't be shocked by that. But they went from about 6% to 7% in terms of breastfeeding at 3 months, and they went from 2.9% to 3.3% exclusive breastfeeding at 6 months, which were notable improvements in a short amount of time. That was in a 6-month period. And we'll continue to monitor those numbers over the next year, especially as many of our partners improve their data collection efforts. Thanks, Lindsay.
Yeah, thank you, Laura.
Any more questions?
So this is Laura again. I just thought I'd add, there's been a lot of demand for sort of evidence of the effect on breastfeeding rates. And so we've initiated a randomized controlled trial with the RAND Corporation, which is a nonprofit research institution based in the DC area. So we're working closely with them, and they've launched a trial in Pennsylvania that began last September. And the results from that trial should be coming out next year in the early part of 2018. So we're eagerly awaiting those, the data from that trial. And as many of you may know, the randomized controlled trial model is sort of the gold standard in research. And so that will really be the best way for us to assess the impact on breastfeeding rates.
Do the participants end up speaking with the same person if they need follow-up, or does it vary depending on the time of day and day of the week?
That's a great question. So it does vary. The way that we're able to provide on-demand support is that we have a national network of providers, and so and we actually don't schedule them. They work in their spare time, very similar to Uber drivers or Lyft drivers. So it's possible, it's even likely for the mom to get the same person if they call at the same time of day, or if they call sort of at 1 p.m. and then they call back again at 2 p.m. But we don't guarantee that they'll be able to speak with the same person twice. What we do though is empower our providers to make follow-up appointments sort of off the app with the mom if that's needed. And they sort of do that on a case-by-case basis depending on the severity or complexity of the issue that the mom is calling about.
This is Karen, and I wanted to ask a question of the attendees. So this work so far has been about breastfeeding, and we were thinking that that's really important work. And I think one idea for integrating it into the WIC program would be to have WIC staff also working for Pacify, not during their day at WIC, but outside of WIC, so that the program could hook California WIC participants first to California WIC staff, a second job, and then across the nation. So that would be one way to support our workforce, but also have people who could answer California WIC questions. Second, though, would be we have a lot of drop-off after 1 year, and FNS didn't support using RDs, but if we went out for private funding, we could do whatever we wanted, basically, based on the funder, but they wouldn't have the same concerns. And we wanted to propose to you guys that parents might be interested in this for their toddlers and for nutrition support or parenting support, say for baby behavior issues, toddler issues, cooking, shopping in the grocery store, and that might support engagement with the WIC participants, with California WIC staff post 1 year. What do you all think about that, or what ideas or thoughts do you have about the nutrition side of it or the parenting support aspect of it that might help our child retention rates?
So you could type the answer to that if you have one into the question box, or again, click the little hand icon to raise your hand and I'll unmute you. So someone says, I think that's a great idea to have WIC staff be involved.
This is Laura again. I just wanted to piggyback off of what Karen said. So another idea that was actually brought up by the DC WIC program, and we worked with Mississippi on this as well, was just to use Pacify to support the peer counselor program and to strengthen it. So we know that in most states, the sort of gold standard again for the peer counselor program is to have a designated breastfeeding expert that's also an Ibclc, but in a lot of clinics that's not always possible, or sometimes the Ibclc that is the designated breastfeeding expert isn't available on an on-demand basis. And so in both DC and Mississippi, as well as in Virginia, the Pacify app was given out to all of the peer counselors in addition to the moms, so that if a peer counselor was working with a mom, she could bring an Ibclc into that consult if anything fell outside of her scope of practice. And the peer counselors were they were as in love with Pacify as the moms were because of that. It really helped them in their professional development to be able to call in an Ibclc as needed. So I'd be interested to hear those of you who have established peer counselor programs in California. I'd be interested in hearing your thoughts on working with us on that as well.
We had a request for Karen to repeat the question. So Karen, if you would like to do that.
Sure. So one, I actually put two things out there. One is thinking about supporting our WIC workforce to work for Pacify. It wouldn't be on WIC time because that wouldn't be legitimate, but we could build up the opportunity and market the opportunity that WIC staff could be working for Pacify outside their time, and so that when the Pacify subscribers, potential Pacify subscribers in California called, the program can actually push them to California WIC providers first, who could have a familiarity with the California WIC program before pushing them out to any lactation person across the nation. So that would be one idea. Because we're different from Nevada, right? We have a lot of nutrition and breastfeeding staff. That's one idea. And the second idea is to really look at the nutrition side of the Pacify app that could help support parents post, well, anytime, but maybe to help stem the reduced participation post 1 year with, toddler behavior, cooking issues, shopping issues, and, tapping into the parental and nutrition support that we could be providing that might keep families participating for a longer time. So one person commented, I think providing support for parents after the first year mark is important. We're seeing participants drop off after the first year, and this may be a way to give them an added benefit value. Somebody else agreed they thought that would be a good idea. Another person agreed it would be a good idea, but just need to consider that the RD in California wouldn't necessarily be available at the hours needed by the WIC participants. If the participant is shopping at 1 a.m. and has a question, and the RD is going to work at 8 a.m. the next day. So Laura can talk to you about how Pacify staff schedule themselves as being available. And then somebody else commented, participants may be more willing to stick around because of this added value benefit that is outside the benefit of the checks. Yeah, I guess the idea was the checks are important, efficiency is important, but we know historically for the last nearly 50 years, personal contact with WIC staff are important, but could we make some of this personal contact happen through technology? And would this be an opportunity to do that for all the years it's possible to be a participant?
I went ahead and unmuted you if you have something you need to add, because I saw your hand.
Thanks, Margaret and Karen. Thanks for repeating the question. As a small frontier community, what I have in place is with a subcontract with a larger agency, and we have had the opportunity to do some teleconferencing with Ibclcs. And what I can tell you is that you don't lose that personal contact because our participants are coming into our clinic. They know who they need to ask. But what we do is we lead them to see that professional or talk to that professional so that they actually have more trust with that professional because they're in our office list and they believe that we're going to lead them in the right direction. The pluses that I see with this Pacify app, especially when you're looking at in-clinic using an iPad, and is that you're getting away from, especially if you're a county organization such as mine, you're getting away from that. There's so many blocks on being able to get anything through our computer systems from county to county, even utilizing within the WIC program based off of other computer systems, based off of, like in small frontier communities, we only have a limited amount of service available, and so they won't allow us to even look at, I mean, we've been looking for Skype Business, and while it would work fine with HIPAA compliancy, the larger agencies, no problem, what we're finding, we're hitting a block here in frontier communities is that we don't have that available, what's the word for it, the amount of service that you need, I guess, gigabytes or whatnot. So this would definitely help that. And then the other thing that I just noticed last month when I was doing quality assurance with our staff, as I was watching moms when they were talking with our nutrition assistants, they were actually on their phone verifying everything that they were saying through some app or what form. So if this is something that we can create a valid response, and I think it would help our WIC and our California moms who are already online checking the validity of what we're saying. I'm done.
That's great. Thank you so much. This is Laura again. So we agree. I think that the opportunities for telehealth are especially valuable from a health equity perspective, but also just from a connectivity perspective and a usefulness angle in the frontier communities and in the rural and remote areas. I think Lindsay may want to speak to this as well because that's where we sort of started with Nevada again. I did want to mention there was a question about price earlier. We do also have the individual license model where the clinics are giving individual moms 24-hour access to Pacify. We also have a tablet model that Lindsay touched on, and that's much more affordable for smaller agencies to start with. Often those tablets range from $8,000 to $12,000 for unlimited support for a year. And that can be a sort of more viable option for some of those smaller agencies that may be wanting to hire an Ibclc but aren't able to find one to hire. Or same thing with an RD.
We have a couple more questions. One is, once a participant is no longer on the program, do they have their Pacify membership revoked? And then the other one is, how does Nevada WIC keep track of participants who are given access to Pacify, and how do they limit access once the participants drop off the WIC program?
That's a great question. So this can be customized state to state, and it depends on sort of the state's interest in doing this. But in Nevada, I believe we were sharing enrollment reports on a weekly or monthly basis, and they can check that against their enrollment, and they can let us know. If any of the moms on that list are not Nevada WIC participants, and then we can deactivate their subscriptions. We have a charitable mission at Pacify to sort of serve any mom who needs the help but can't afford it, and so we actually haven't seen the sign-up codes get out, so to say, or be used. You know, I don't want to use falsely. So that hasn't been a huge problem, but we do that, especially with we have partnerships with Medicaid plans as well, and the Medicaid plans are obviously concerned about giving access to moms who aren't enrolled in their plans. So we do work with you on that, and usually it's through some sort of cross-check on Pacify enrollment and WIC participation.
And this is Lindsay too. Another thing that we did to try and mitigate any of that was when we were able to introduce the app to participants in the clinic setting, and we were able to have WIC staff actually download the app with the mom there and do a test call, which is sort of the best practice. We would have the WIC staff enter the code. So the mom wouldn't know the code. She would just have access for a year. So that was one way that we, limited sharing of the code, was by having the WIC staff actually input the code and then just give the phone back to the mom to do the test call with the staff there in the clinic.
And then the question about whether or not the membership was revoked. So with this new extension that Nevada is doing, and with the expansion that we're working on in DC as well, because of this sort of statewide unlimited license, the moms will have access as long as that program is continuing. And so the sustainability plan with both of those states is to continue receiving funding next year, and that will continue the availability of service for participants.
Okay. Are there any more questions or comments? So here's a question for all of you who have your parent organization as a primary care health center. Have you used or looked at any of the telehealth that your clinics are using? Are they using hardware? Are they using apps? Because the healthcare industry is moving forward on this. What's been your observations? Mary, I unmuted you if you can. Okay, I think I did. Oh, don't have a mic. Okay, you can, if you want to type in, I can. So Mary says, we do use telehealth in rural locations for behavioral health, don't know details of the system, and we're using telemedicine daily using hardware video conferencing. Oh, that's Rose. We are using telemedicine daily using hardware video conferencing. Yeah, that's what we've heard, is most of the health centers are using it for behavioral health. But why not talk nutrition or breastfeeding? Are any of your clinics purchasing apps? Because hardware with telehealth is one thing, but we would think that healthcare would be moving towards apps also. Maybe something to ask your health centers.
Yeah, so one other thing I can add, Karen, is that the Pacify app has a lot of built-in flexibility around which networks we can include. So when Lindsay showed that first slide of what the home screen of the Pacify app looks like, you saw that it had the 3 buttons with the nurse and the pediatric nutritionist, as well as the lactation consultant. And so those are the 3 networks that, that Pacify provides. But we're also able to integrate any networks that a community health center or a Medicaid plan or a WIC program may be able to offer. So we could, any additional network that an agency would be interested in including access to via the Pacify app, we'd be happy to work with them on that as well. So there'd be a little bit the time and resources needed to do that in an existing app might be less than doing it yourself, trying to build a new app to do that.
Right. Yeah, some of the folks on the line say their health centers are also using it for specialist care. These are, this is Rose from Ibclc, which is a rural health center. When we had a webinar last year, I don't know if any of you were on it, from Arizona WIC, and they're using Skype from clinic to contract RDs who are in their own offices or homes. And the problem with Skype is similar to what Irina mentioned earlier, is the county firewalls and problems with bandwidth, but also just speaking about Skype specifically, they found out Skype has daily updates. So that makes a challenge for everybody involved if the updates, at least in the Arizona example, there was a problem with getting those daily updates in the county health system as compared to the health centers where they had a parallel system set up. So those details are really important to know about, and that isn't an issue with the phone apps in most cases.
That's right. We do update the app every month or so, and that's just to sort of keep any issues that are newly arising resolved. But the earlier versions of the app are compatible with new versions of the app, the provider app, so they can talk to each other just fine if someone isn't updating the app on a regular basis. And the other thing I wanted to mention about Pacify was that it was designed with the low-income population in mind in terms of the bandwidth needed to connect a call. And so the video technology that we use is designed to degrade in quality based on the connection level that the app user is using.
Okay, is there anything else? Well, thank you so much, Lindsay and Laura, for joining us today and teaching us about this. I think it sounds really exciting.
Absolutely. Joining us.
And I don't know, is your contact information on the last slide in case anyone thinks of a question later on? Was that there?
I don't think I have it. I can type it in the chat box. Well, I don't know if everyone sees the chat box.
You can also, if anyone wants to get in touch, they can always get in touch with us here at CWA and we can pass it along too.
And if you're willing to share your slides with the attendees, if you just want to add that, we can share the slides with the attendees if you're comfortable with that. If not, we can share your contact via email.
Absolutely, that's no problem. I will happily share the slides with you all.
Okay. Well, then I think we will wrap it up. Thank you so much, everybody, for joining us, and thank you again, Laura and Lindsay.
Thank you.